Hey guys, it's Jasmine. I'm coming back at you with another video. I'm going to talk about cyanotic heart defects. This one, I'm going to start talking about Tetralogy of Fallout. Uh, as I think Jimmy Kimmel's child had this. So, um, yeah, so here we go. So, Tetralogy of Fallout indicates four different things, and I have the little thing right here. So, with Tetralogy of Fallout, the thing that we use in nursing is drop. Okay, and this describes what's actually going on with the heart. Okay, so you have a displaced aorta. So, how do you have a displaced aorta with a child? So, the child is actually so what's going on with the heart, with the aorta in general? Because of an open septum, which is the O, the left ventricle is pumping oxygenated blood into the right ventricle, number one. And then with the aorta, now you have a mixture of oxygenated and deoxygenated blood in the aorta, right? Due to this open septum. Now, the R stands for right ventricle hypertrophy, okay? So an enlarged right ventricle. Hypertrophy, excuse me. Now, the right ventricle is getting bigger because of what's happening. You're having the force of the left ventricle pour blood into the right ventricle, in addition to pulmonary stenosis. Okay. Now, what's happening? The pulmonary artery in tetralogy of fallout is it's supposed to be open like this, but it's like this. Okay, so the right ventricle is getting bigger because it has to work harder because it's getting forces from both sides. Okay, now, the signs and symptoms. How do you know someone has tetralogy of fallout? Um, so one of the key things is TET spells. Now, TET spells is when your right ventricle shunts to your left ventricle. Okay, let me make sure I'm telling you this right because I don't want to. Yes, when there's an increase, right? Increase of right ventricle shunting to your left ventricle. Now, how do we know this happens? So when this happens, basically, it can kill the baby, right, or the child, whatever. In our book, I think the book does a great job of explaining it. Not to say that our teacher doesn't do a great job, but for these for general purposes, it says verbatim, test shows sudden marked increase in cyanosis, syncope, and can lead to a hypoxic brain injury and death. So a test bill is a dramatic increase in that can lead to cyanosis, brain death. Okay, so this is why this is serious. Okay, because it can lead to brain death. Now, anything that aids to the stress of the heart. Woo, in regards to test bells, is dangerous. So let's think. With a baby, what are we going to think about? Crying. Crying's one. So crying, activity. What other type of stress is there? Okay, feeding. Yes, feeding. And one you want to think of is defecation. Defecation just means pooping. This is how Elvis died. Myth, sort of, kind of. But so these three things all cause stress and make a child at risk for a test spell. Okay, and they can die from it. Now, make sure I have everything that she says. Okay, so how are we going to treat this? Okay. Okay. Whew. So how are we going to treat this tetralogy of fallout? So the first thing we're going to do, they can do a few things. If the child is experiencing test spells, what you want to do is put the child's face in their chest, okay? Knee to chest, knee to chest. And with the older child, they can squat down, okay? Knee to chest or squatting is perfect for a child with a test spell because it just helps you breathe. For example, off topic, if a child has any type of respiratory condition like COPD or something like that, a hunching over helps aid in breathing. So that's basically what you're doing. Now, you can administer medications. So meds that help. The first med that helps is morphine. Make sure I get the right address. Yeah. Thank God. Okay. And another drug that helps is beta blockers. They all end in OLOL. Those drugs help too. She didn't really go into why, but probably stops the shunting of the blood. Another thing that they can do shunts. There's a few different types of shunts. So the palliative shunt. So there's the palliative shunt. I'm ready now. So the palliative shunt is just for comfort measures. It's just used for comfort to aid with this tetralogy of fallout. Another thing that they can do is you can do a Balak shunt, a Watterson shunt, surgery. You're gonna have to get surgery because everything in your heart is messed up. They're gonna have to repair a lot of the heart problems in this. They're gonna have to close the ventricular septum. They're gonna have to open the pulmonary artery. They're gonna have to do a lot, okay, to make the heart function the way it's supposed to. Um, I think I'll write down the shunt now. So, you have the Watterson shunt, and then you also have the Balak shunt. The Balak shunt deals with your pulmonary and subclavian, and your Watterson deals with your aorta and your pulmonary. So I don't think you have to memorize that, but just know the shunts. The palliative one is just for comfort care, and then you have Watterson and Balak slash Passig or whatever. But the medications used to treat a tetralogy of fallout is morphine and beta blockers. I don't think that she had anything else on those. So. All right, and okay, she did. Okay. All right, so the Balak shunt, remember, is a connection between your subclavian and your pulmonary, and the Watterson is your aorta and your pulmonary. So, just to review real quick, tetralogy of fallout is a condition of where you have what is known as drop. You have a displaced aorta due to that open septum. You have right ventricular hypertrophy due to that pulmonary stenosis, and with all the blood from the left ventricle entering into the right ventricle, causing all these problems. So what the child is at risk for is test spells. Tests are severe cyanosis that can lead to brain death and ultimately death for the child. Uh, she didn't really go over how do you know. Anyway, since this is a cyanic, obviously probably for members from in your assessment. Since this is a cyanotic heart condition, the baby's gonna have clubbing. Please don't forget clubbing. All these cyanotic heart conditions have clubbing. And things that can cause stress on the heart. So if you know your child has tetralogy of Fallot, which you're probably going to see when they hear it and then they do their echocardiogram, you want to make sure that all the kids' needs are met. That Maslow's hierarchy, that last one needs to be met, okay? Because if it's not met and they're crying, uh, and they're feeding or any type of activity can cause problems, okay? Now, how do you relieve this? You're going to ask them to put their knee to their chest. And for older children, you're going to tell them to squat. Now, the treatment for this is morphine and beta blockers, or you can do your shunts. Palliative one is for comfort care. Your Block shunt is for your subclavian and your pulmonary artery. And your Waterston shunt is for your aorta and your pulmonary artery. And I think that's it. I'll see you next video. Bye. Hey guys, it's Jasmine again. Sorry I had to clear my board off and start over again. Okay, so this video we're going to talk about transposition of great vessels. Okay, it is exactly what it says. Your great vessels have switched. Okay, so what's actually going on is that your left ventricle is connected to your pulmonary artery and your right ventricle is connected to your aorta. Okay, and the only thing that's keeping you alive or the baby alive at this moment is that PDA. So the signs and symptoms. So the PDA is open, okay? And if the PDA closes, whew, have a lot of problems because this PDA is great because what's happening is it's allowing deoxygenated blood and oxygenated blood to cross. Because these things are switched, if it were to close, then you would have deoxygenated blood that serves no purpose for your tissues going to your tissues and your body getting rid of perfectly healthy, supposedly, it's just everything just messed up. Okay. So if the PDA closes, the baby's gonna turn severely cyanotic. So much so that they might look like a Smurf in reality. Super, 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 super blue. Okay. Now, how do we know this is progressing? We know this is progressing if they start experiencing hypoxia. Okay, and hypoxia, and then they'll start getting club fingers. But hypoxia can, remember, lead to acidosis. So when we look at their ABGs, if they're look like they're about to start having some acidosis problems, that's how you know it's progressing. But we can stop it before it gets to that point. To murmur or not to murmur? That is the question with transposition of great vessels. So sometimes with this one in particular, you can have a murmur or you may not have a murmur. It's just often the key sign of this one is severe Papa Smurf cyanosis. Now, how do they treat it? So what they're going to do initially, they have to give them prostaglandin E1 to keep it open, okay? Okay. They're not going to give them a prostaglandin inhibitor like indomethacin with ibuprofen IV. They're not going to give that because if they did, that it would cut this PDA's lifespan short and cause a whole slew of problems. Now, eventually, they're going to have surgery to correct this problem. But the main thing with this is just know the side of can't smell today. Struggles for Hill. Gosh. The main thing with this we're still going to do our nursing assessment. This one is just, majority of these are just to know what to do, and what you should expect when you hear them. But make sure I'm not missing anything from her beautiful notes. That's it. All right. So, that's it for transposition of great vessels. All right, so I'll see you guys later. Next video is going to be about hypoplastic left heart, which is very interesting. So hold on. Hey everybody, I had to erase my board and start over again. Okay, so this video, this little segment of this video, I'm gonna talk real quick about the last cyanotic heart defect. It's called hypoplastic left heart. Uh, Hypo means under, plastic means developed heart, left-sided heart. Okay, so what's going on? Okay, in a child with the hypoplastic left heart defect. Okay, the left side of their heart is severely underdeveloped. That aorta is underdeveloped. That left ventricle is underdeveloped, and that arch is severely underdeveloped. But they have an enlarged atrium. Now, so if all of that stuff is underdeveloped, the left side of their heart, how are they getting blood? Okay. The only thing that is helping them keep that blood is two things. Well, mostly one thing. The most important thing is that atrial septal defect. Now, in a previous video with the ASD in regards to acyanotic heart defects, that ASD is actually what is, because there's no blood, they basically do not have a ventricle on the left side. So there's no way to push blood up. So when the heart pumps, it goes straight from the left atrium to the right atrium, and that oxygenated blood gets mixed into the right ventricle and then gets pushed up from the right ventricle to the pulmonary artery. So that is the only way that they're getting that oxygenated blood to uh, to pump it through the body. Now, the ASD is doing great. However, since their aorta and the aortic arch is underdeveloped and basically non-existent, the other only thing that is aiding in delivery of oxygen to the extremities is that PDA. So you without that PDA, it doesn't matter what the ASD is doing, but you want to keep that PDA open, okay? Now, all the signs and symptoms of heart failure are associated with hypoplastic left heart defects, okay? That includes decreased peripheral perfusion, cyanosis, clubbing, edema, periorbital and facial edema for young children, difficulty breathing, retractions, nasal flaring, poor feeding, all this other stuff that's associated with both or either or age groups. Now, how do you treat this? So the first priority of the doctor when they find this out, or the nurse, I'm not going to toot our own horn, but nurses rock. So the first thing when the nurse finds this out, she's going to ask the doctor to recommend to get a prostaglandin, the E1. Because that prostaglandin will help keep that PDA open. You want that PDA open. Once that PDA closes, there is no blood being delivered to the organs, okay? So you want to make sure they maintain that opening. The next one comes in stages. The ultimate thing they're going to have to do, they're going to have to get a heart transplant. There's no way you can repair a left ventricle that is basically non-existent. But there are some treatments that you can do to help aid in the relief efforts throughout time, because it takes time to get a heart transplant. First of all, they're very expensive, and not everyone's dying to give the heart of their baby who may have died to a complete stranger. So the first treatment is for newborns for birth. The good way to remember that, Norwood starts with the N, so do newborns. So they give that to them after birth. Glenn. Glenn is given 4 to 12 months. Yes, 4 to 12 months. A good way how I sort of kind of try to remember that was because Glenn starts with G, so does grab, okay? Around that time, developmentally, children start grabbing and spacing things out with their hands. So grab 4 to 12 months. Modified Fontaine, that is given when they're 18 months old till they're 3 years old. So just modified Fontaine, moving footwork. At a year and a half years old, children are walking and they may be dancing. So modified Fontaine, you know that is between 18 months and 3 years old. Is that it? That seemed like that was really quick. Oh, and also they have a 50% survival rate, especially if you don't get it back fast. Um, that's it. Okay. All right. So teaching them about congestive heart failure. So let's say a mom or a dad got any of these types of, or a grandparent, whoever the guardian is, they got any type of diagnosis of heart failure. You want to educate them on the procedure, the process, the signs, and the symptoms. Okay. And you want to also decrease as much stress on the heart as possible, while also trying to maintain diet and nutrition. Child with heart failure, again, any type of heart condition, they need calories. Okay, nutrition is big. So if they can't eat, we're gonna have to do something. Um, and also another one, this big one is monitoring for signs of growth and development. Okay, every child is at a different stage, so we have to keep in mind that we have to keep monitoring children. Um, So, in regards to different procedures, too, you want to make sure that they know the pre-op instructions, like on the cardiac catheter video, NPO, laying flat. Uh, just go through those things with them. Uh, First 24 hours is quiet play, things like that. And here's a big thing. Let me get into another video when I talk about endocarditis. Um, with a child who has going to have heart surgery or who's had heart surgery, you want to let the dentist know that they've had heart surgery, because if not, an infection called endocarditis, I know for adults is very serious, but since we talk about peds, it can cause an inflammation on the lining of your, let's say, your metrium, which your mitral valve. Why did I say mitral? I'm tired. Your mitral valve, which is between your ventricle and your aorta, and it actually aids to get blood flow to your ventricle. And if you have any type of infection on there, it's not going to close and open properly, which can lead to murmurs, which can, over time, if it's not treated, an infection in your heart tissue. Your heart tissue doesn't regenerate. Um, so if you got an infection in your heart tissue, just prevent it from happening. So you're going to have to talk to them about prophylactic in regards to trying to prevent endocarditis or any other bacterial infection. Um, and then, like, signs and symptoms of worsening conditions. If you notice that they are getting more like Papa Smurf, or they're doing good, and then you notice like their breathing rate gets a little faster. They're starting to use, like, babies are starting to be nasal flaring more. Um, it's just there's just signs and symptoms of worsening conditions. And one of the signs of the worsening condition is hypoxia. And then just educate on the meds and what they're using them for, like indomethacin, ibuprofen IV, just things that help with or the morphine and the beta blocker in regards to heart problems. And I think that is it. And then the next one we're going to talk about in another video is rheumatic fever, Kawasaki disease, bacterial endocarditis. And that's going to be it for this heart lecture. Bye.